also check for microscopic blood because that's the current test. And then it closes up and it gets sent off to the lab. Now make sure that you have the right label on it because you don't want to go somewhere else.
It makes you, tighten the lid a lot.
Yeah, yeah, that's for sure.
Who should be using this?
So that's the thing. This is part of a toolkit of many different interventions we have to prevent colon cancer. And I think the most important message is that any of these tests will really have a potential life-saving intervention. This is a test that should be done by only people who have no risk. If someone has a risk, then they would need a more conventional study like a colonoscopy, which not only can detect cancer, but can also detect the precancer, what's called a polyp. A polyp is a growth that has the potential of turning into cancer. So a colonoscopy can potentially prevent colon cancer, where this test really can only detect early cancer. So there is a difference. However, it's so simple and at home, there's no excuse not to do one of these tests. And that's the real take-home message. You have to do something. There's no excuse just to avoid colorectal cancer.
So if I understand correctly, about a third of people don't do anything.
That's right.
And so let's just start with that 1/3 of people. They don't have any of the big risk factors. They ought to be doing this. It's still, I checked it out, it costs almost $600.
Right.
So does insurance cover it?
Yeah, well, the nice thing is both the FDA and the CMS actually both approved it. So although it's not covered yet, I'm sure it will be, and they should always check with their insurance company. There's some very inexpensive alternatives. The standard just occult blood, which is called fecal immunochemical test, is relatively inexpensive, less than $25 if there's an insurance issue. And of course, colonoscopy remains the gold standard. It's one that, if negative, is actually good for 10 years. If this test is positive, it still needs a colonoscopy to make the diagnosis, to look in and find the cancer if this test is suggesting there is one there.
From what I can tell, folks, this will be covered by most insurance companies within 3 to 6 months. That's how effective and promising it seems to be. Bottom line, I think you've covered it. Colonoscopy, you get on yourself if you could, but if you're not going to get a colonoscopy, this is something that's worth happening.
Exactly. I think the bottom line is the right test is the one that gets done. You should discuss with a doctor. This needs to be prescribed by a doctor. This is not something that you can just go and get on your own. So the discussion needs to be had. How can I prevent colorectal cancer? And this is one option, and the vast majority of people will try and do something if it's recommended.
So let me shift gears for a second, because I'm sort of seeing this as the mammography of the colon. Is that a reasonable
Yes,
metaphor?
because what this does is it finds early cancer. So in many ways, this is like doing a mammography finding early cancer for the breast. This is finding early cancer of the colon. Whereas colonoscopy might prevent it, this is actually finding it when it's small.
So with mammography, you use the test to identify cancers that you couldn't feel,
That's right.
theoretically, but you still want to feel your breasts. So what's the equivalent in colon cancer? You can't put your hand in there and check.
No.
Are there signs and symptoms you look for in talking to your patients to identify whether they might be at risk for having a colon cancer?
Absolutely. And if there are signs or symptoms, then you're looking at diagnosis, you're no longer screening. But surprisingly, Mehmet, the most important sign is the fact that someone's feeling well. And I know that sounds crazy, but actually when cancer is really small in the colon, there's no symptoms at all. But the number one symptom, if you're going to start finding it, is something like a change in bowel habits, discomfort. So things of that nature, if you find it, you need to make sure you get it
And
explored.
how about changing the size of the poop?
Thinner and